Have you ever imagined being in a hospital and not being able to understand what the doctors are saying? Picture yourself or a loved one in a sterile white room. The doctors and nurses, shrouded in masks, converse in a language that's foreign to you. They gesture, they probe, they expect answers. But how can you respond when their words are unintelligible? How can you relay your symptoms, your fears, or comprehend their diagnosis? It's a daunting experience, isn't it? Now imagine this scenario being a constant reality in your life. This is the everyday experience for deaf individuals in healthcare settings. They confront not only the anxiety of illness, but also the challenge of a language barrier. And it's not just a handful of people. This is a reality for hundreds of thousands of deaf individuals across the country. Imagine a world of silence where communication is a constant struggle. Picture yourself as a deaf individual navigating the maze of healthcare. You're in a sterile hospital room, the air thick with uncertainty. Medical professionals speak in a language foreign to you, their words masked by their protective gear. They expect answers, but how can you respond when their words are but muted echoes? The struggle to comprehend medical terminology feels like deciphering an alien language. Describing your symptoms becomes a game of charades, hoping they understand your silent cries for help. The diagnosis, a series of complex terms and jargon, is handed to you, a puzzle you're expected to solve. The information is crucial, but it's lost in the chasm of communication. This is the disheartening reality for hundreds of thousands of deaf individuals seeking medical care. Deaf individuals deserve the same level of care as non-deaf patients. Enter the medical interpreter, a bridge between the deaf community and the healthcare system. These professionals play a pivotal role in ensuring equal access to healthcare for the deaf community. They are more than just linguists. They are a critical link in the chain of care. Medical interpreters are highly proficient in both American Sign Language and English. This dual fluency allows them to navigate the nuances of both languages, ensuring clear and concise communication between the patient and healthcare provider. They are not only linguistically competent, but also culturally aware, understanding the unique experiences of the deaf community. Beyond language skills, medical interpreters are familiar with medical terminology, which can be daunting to the layperson. They are equipped to translate complex medical concepts into understandable terms, enabling deaf patients to grasp their medical situation fully. In essence, medical interpreters act as advocates for deaf patients, ensuring their voices are heard, their questions are answered, and their healthcare needs are met. Qualified medical interpreters can make all the difference in a deaf individual's healthcare journey. So, why are medical interpreters so important? Well, let's delve into that. Medical interpreters aren't just translators, they're lifelines, bridging the gap between healthcare providers and deaf patients. They facilitate effective communication, which is absolutely crucial when someone's health is on the line. Imagine a patient trying to explain a complex symptom or a doctor attempting to convey a critical diagnosis. Without a common language, this interaction can quickly turn into a dangerous game of charades. Medical interpreters, however, change this dynamic. They're highly proficient in both American Sign Language and English, ensuring clear communication regardless of the complexity of the medical scenario. Moreover, they're well-versed in medical terminology, enabling them to translate intricate medical jargon into understandable language for the patient. This ensures that patients fully comprehend their medical situation, empowering them to make informed decisions about their health. Without a qualified medical interpreter, a doctor's office does not provide quality services to deaf individuals. There is no room for misunderstanding when it comes to health. This statement rings true for every individual, but more so for our deaf brothers and sisters. The time has come for a change, a shift in our healthcare system that respects and upholds the rights of every patient, regardless of their primary language. Medical interpreters are not just a convenience, they are a necessity. They bridge the gap between the medical professionals and the patients who use American Sign Language or another sign language. They are the lifeline, ensuring that accurate diagnoses are made, appropriate treatments are administered, and most importantly, that the patient's voice is heard. Every healthcare institution must recognize this need and provide medical interpreters upon request. This isn't just about providing a service, it's about respecting human dignity, about fairness, and about equal access to potentially life-saving information. In the healthcare setting, equality means equal access to communication. Let's make it a reality.